And we've got more breaking developments coming in after Indore water contamination tragedy claimed several lives. Gujarat's Gandhinagar is now also grappling with the similar health scare. Officials have confirmed that in the Gandhinagar Civil Hospital, 152 patients have been admitted, out of who 108 patients have been suspected of suffering from typhoid. Out of these 108, 50 patients have been confirmed to be suffering from typhoid. Most of the patients are between the ages of 1 and 16. Typhoid and other respiratory cases have also been reported. Primary factor of this disease and infection is said to be water contamination.
Gandhinagar has seen recent surge in cases related to typhoid. Now joining me is Dr. Meeta Parekh, who happens to be the medical superintendent of Civil Hospital, which currently has 100 plus of patients carrying symptoms and few confirmation of typhoid. Parekh ma'am, if we just try to understand what exactly is the figure that this hospital is currently holding, how many patients do we have which are suspected to be of typhoid, they are affected with typhoid, and how many have been confirmed?
As of now, today, we have 152 total suspected cases, total admitted cases, and out of them 108 are suspected cases and 50 are serum viral positive cases, and 25 we have discharged yesterday patient, total discharge. Mostly all are from the age group of 1 to 16 years, mostly 5 to 6 years of ages are more. It is a mostly of cases of typhoid plus other respiratory infection cases are also there.
And what could be possibly one of the factors, because what we understand through ground that it is due to water contamination, is that the primary factor?
Yeah, the primary factor is water contaminations of drainage pipelines and that water supply.
Currently, I'm reporting from Gandhinagar's Civil Hospital, the hospital which is currently in talks after several individuals have suffered with typhoid, and the reason that is being given out is due to water contamination. The ward behind me is of pediatrics department, which happens to be explaining that it is not just adults but also kids of small ages who have also been suffered with the water contamination. Here you can see all the beds which have been put in place are currently filled with small minor patients along with their family members, their mothers who have reached out to the hospital to take care of their small kids. And these are not the only beds, but I would request Chandan to pan around the camera to the right as well. There also you can see the beds have been put in place, and all of these beds are completely filled with minor children aged from 1 to 15 to 16 years of age. We'll try to speak to certain patients who have reached here to for the ailments that they have been complaining. Ma'am, आपसे जानना चाहेंगे आपके बेटे को क्या तकलीफ है, कब से है तकलीफ?
यानी ताव से
बुखार है।
हाँ बुखार है।
ओके। आप हिंदी बात कर पाएंगे?
हिंदी नहीं आती।
अच्छा। अगर कुछ समझा पाए आपके बच्चे को क्या तकलीफ हुई है, क्यों यहाँ पर?
बच्चे की तकलीफ है, वो खाता नहीं पीता नहीं है, ताव चालू रहते हैं, ताव भी उतरता नहीं है।
कितने दिन से समस्या?
लगभग अठवाडिया थी।
आज तीसरा दिन?
अठवाडिया थी। हाँ हाँ।
अभी बच्चे की हालत कैसी है?
अभी थोड़े ठीक है, दवाखाने में लेके आए, ठीक है।
My colleague Nilesh is now joining us from Gandhinagar. Nilesh, we know that typhoid has become rampant there, but what steps have been taken now, and do we know what is to blame for this?
Well, quite a step is being taken by the local authorities, especially from the medical aspect. Medical staff are currently working on ground. The municipal corporation is also reaching out to these areas which are reporting high number of typhoid cases or suspected typhoid cases. But it is quite difficult to understand the kind of steps which are being taken. Seems to be more of a cosmetic step, given the point that we reached onto these areas, and through our eyes it was quite evident, quite visible to see that the water pipelines are ruptured, they are still leaking, and what is also concerning that the water pipeline is passing parallel to the sewage pipeline, which is getting cosmetic steps being taken because they are being covered from upper end. That is, the surface layer is being covered up. However, the leakage still continues below the surface, and that is one of the concerning point. The staff members are reaching out to conduct the purity test of the water samples. Chlorine balls are given out to the family members as well. But given the significance that the number of patients are also constantly in the rise, does raises a lot of many questions as to how effective these measures are. Because as we spoke to the medical superintendent of civil hospital, which is currently suspecting of 108 typhoid cases, out of which 50 have already been confirmed. Another point of worry is that the minors are directly impacted by this typhoid case, or which is ultimately led due to the water contamination as given by health experts as well.
And this matter is being picked up by the opposition as well. Uncanny similarities there between what has happened in Gandhinagar as well as what just transpired in Indore, where multiple lives have been lost. We know that Union Home Minister Amit Shah himself took note of what has happened in Gandhinagar. He has said that action should be taken on war footing, but we've got political reactions coming in from the opposition. Listen in to what TMC has to say what happened in Gandhinagar.
But now this so-called double engine ki sarkar has failed brutally. The people of India wanted nothing, actually nothing, but these criminals have failed to provide a basic necessity, which is drinking water. I mean, how on earth were the PM is talking about Viksit Bharat, trillion-dollar country, competing with Japan, but our people in Madhya Pradesh and Gujarat are dying because of drinking water, which has been contaminated? Are you serious?
There can be absolutely no excuse for the kind of negligence that is being seen. Poisoned water, whether it is Madhya Pradesh or Gandhinagar in Gujarat. The unfortunate truth of the matter is that eyes are open only when somebody loses his or her life. We earlier told you about how in Gandhinagar there is a young girl who has lost her life, and 3 of her other siblings also have been hospitalized. Moving on, shifting focus